So hey guys, what's up? So welcome to World News to a new channel. So let's talk about to use malaria drug or not to. On Thursday, Mumbai's municipal commissioner said the drug hydroxychloroquine will be administered as a preventive to 50,000 people in COVID-19 hotspots, down from the earlier plan of 1 lakh. While this is a scaling down the national protocol for hydroxychloroquine, and announced during the outbreak is that it is to be administered it to a very specific group such as the healthcare workers exposed to COVID-19 patients. Besides the hotspot, the Maharashtra government has also begun administering the drug among the Mumbai police personnel, while Rajasthan has cleared it for police posted in hotspots. What is hydroxychloroquine? Hydroxychloroquine is an oral prescription drug that is used for the treatment of some forms of malaria as well as autoimmune disorders such as the rheumatoid arthritis and lupus. In use since the 1940s, the drug has shown antiviral properties that have been studying for the last 40 years. A combination of anti-malarial drug chloroquine and hydroxychloroquine, which is a derivative of the chloroquine, is among the 4 lines of the possible COVID-19 treatment that are being investigated by the global solidarity trials under the aegis of the World Health Organization. While the efficacy of the combination is still being studied in the lesson, rheumatology has found that hydroxychloroquine decreases the acidity in some compartments in the cell membrane, since many viruses use the acidity of these compartments to breach the membrane and set off the process of the replicating copies of itself. The reduction of acidity can potentially inhibit viral replication. In 2005, the drug was used to treat SARS, but it failed to decrease the viral load in mice. The WHO notes that there is insufficient data to assess the efficacy of either of these medicines, hydroxychloroquine and the chloroquine, in treating the patients with the COVID-19 or in preventing them from contracting the coronavirus. What is the national protocol on the use of the hydroxychloroquine in the COVID-19 outbreak? In the context of the COVID-19, the Indian Council on Medical Research has recommended hydroxychloroquine in very specific cases. It is to be used as a post-exposure prophylactic preventive medicine by asymptomatic healthcare workers involved in the care of the suspected or confirmed cases of the COVID-19 and by asymptomatic household contacts of laboratory confirmed cases. According to some news agencies, discussed the possibility of using the drug at a population level, but the option was not taken forward. A source told this newspaper that during the discussion, questions were raised about the evidence available on the efficiency and side effects of the drugs. Maharashtra, Rajasthan, 2 of the states with the highest COVID-19 counts, have independently decided to allow the use of the drug beyond the healthcare workers. The Rajasthan Health Department has issued an advisory on administering hydroxychloroquine to policemen in COVID-19 hotspots. What has Maharashtra decided? The plan announced last week was that about 1 lakh people in the COVID-19 hotspots, starting with the Dhari and the Wali Golwar slums, would administer the drug as a prophylaxis. On Thursday, the BMC revised it to 50,000. A technical committee comprising AIMS doctors, Niti Aayog experts, and officials from the Maharashtra University of Health Science and Public Health Department met on video conferencing on April 13 to discuss the medication. 2 groups will be created. One group will be given hydroxychloroquine along with the vitamin C tablets, while other will be given hydroxychloroquine along with zinc tablets to assess which combination has better outcomes. The BMC said last week that the drug would not be made compulsory, but slum dwellers will be counseled to be administered it. The drug will not be given to the people aged below 15, heart patients or pregnant women. For people aged above 55, the drug's effects will be closely monitored. Mumbai police began the use of hydroxychloroquine last week after several persons starting showing symptoms. They are given hydroxychloroquine along with vitamin C tablets based on medical advice. What is the justification being given for all this? Mumbai's population density is 26,453 per square kilometer, states the environment report of the Brihan Mumbai Municipal Corporation. In 2018 to 2019, and in slums, the population density doubles, and at least 5 to 8 people stay in 1 into 10 square feet room. In the Dhari, where cases have already crossed 50. In such places, social distancing is not possible. We are advising hydroxychloroquine for the population in these hospitals as a preventive measure, said Dr. Subhash Lange, who helped Maharashtra frame the policy. This was before the number was scaled down. The entire population in the Dhari and the Worli is considered highly burdenful. Government officials see them all as a high-risk contacts. After the target was reduced to 50,000 on Thursday, Municipal Commissioner Praveen Paraleshi said, "We are doing this on an experimental basis. The control group We don't want to give it to a huge population. Additional municipal commissioner Suresh Kakani said there are known side effects. The civic body held a discussion of the last few days on how many and how all would be given hydroxychloroquine. What are the concerns? Besides the fact that the hydroxychloroquine efficacy as a COVID-19 cure or preventive is not yet established, they are concerned about the side effects. AIMS Director Dr. Randeep Gulera stressed hydroxychloroquine is not a treatment for everyone. This drug has its own side effects. One of them is a cardiac toxicity leading to irregular heartbeat. Dr. Gulera said last week France National Drug Safety Agency raised the red flag over such side effects, especially in the COVID-19 patients. It released data of the 43 patients who were given the drug and reported heart incidents linked to the drug. The drug should only be used in the hospitals under close medical supervision. This initial assessment shows that the risk, in particular cardiovascular, associated with these treatments are very present and potential increase in COVID-19 patients, the agency said. On May 25, a clinic cardiologist had issued a warning about the potential side effects of the drug. The team headed by the Dr. Michael D. Ackerman released under guidance on patients at risk of the drug-induced sudden cardiac death from off-label COVID-19 treatment. The specialist pointed out that the drug is known to cause drug-induced prolongation of the QTc of some patients. QTc is a major related to the heart rate and ECG. The specialist said patients with prolonged QTc are at risk for the abnormalities that can lead to dangerous erratic heartbeats and also culminate in sudden cardiac death. Another retrospective study yet to be conducted at the New York University Langone Medical Center looked at the 84 COVID-19 patients, hydroxychloroquine and the antibiotic azithromycin of a combination being strongly pushed by the US President Donald Trump. Although the evidence is emerging, the New York study made two observations. In 30% of the patients, QTc increased beyond the normal range, and in 11% it rose to a level that represents a high-risk group of the arrhythmia. So if you like the channel, so kindly subscribe to it.